conhIT 2011. IT solutions for practices and hospitals will be under the spotlight in the next few days. Representatives of the sector gather at conhIT in Berlin at the start of the year to learn and educate themselves about the latest developments and trends via the industry exhibition, conference program, and various networking and academy events. And IT in the context of healthcare is becoming increasingly important, given the challenges presented by demographic shifts. We will only be able to rise to these challenges by making better use of new technologies and ICT, which means we will have to make telemedicine a cornerstone of future healthcare policy. A significant boost to the industry, conhIT in Berlin was first launched in 2008 and has quickly established itself as the most important health IT event in Europe. Since the event was launched, we have seen an increase in exhibitors of almost 70%, and this year there has been another 20% increase against last year. We're delighted. In the meantime, we have a little over 240 exhibitors. The event showcases the entire spectrum, from hospital and practice information systems to special IT solutions for healthcare, all aimed at better care for patients. Topics such as security, networking, and cost-effectiveness are top of the agenda. Mobility is also becoming increasingly important. An additional trend alongside existing components, that is to say trends towards increasing connectivity in hospitals or networking on an intersectoral basis, is mobility. It's all about users being able to gather and document data on the spot. But you also want to be able to update data when you are on your way to somewhere else. And it has become clear that many companies are striving harder than ever to meet the mobile demands of their customers. This year, conhIT witnessed a 30% increase in attendance, and the mood among exhibitors was also overwhelmingly positive. This is a very big trade show. We've had an incredibly positive response from our existing customers and also from potential customers. But conhIT is much more than a trade show. As well as product presentations, there was also a convention and an academy, providing information about the very latest trends in healthcare IT. Networking was also high on the agenda. Events ranging from podium discussions to topic-oriented tours brought together actors from across the sector. One of the highlights was a discussion on IT programs at the European Commission. To speak with one voice and represent all of the interests of the health IT sector externally, 3 associations created a single federal association at conhIT, BVI-TG. The aim of the new association is to establish a single point of contact for politicians, self-government, anyone seeking contact with health IT and the e-health sector in general. And we have achieved our goal by including 90% of all HIS providers, 90% of all health IT providers, and the majority of dental software vendors in our association, and by signing up as members a number of other providers of secondary health IT solutions. This year also saw another first. The event had a partner country for the first time. The Netherlands, represented by a total of 17 exhibitors, attracted considerable interest. With 4,434 trade visitors over 3 days, which represents an increase of 30%, and 20% more exhibitors compared with last year, conhIT 2011 was a resounding success, leaving expectations high for next year. The dates for next year's event have already been announced. Trade visitors and exhibitors will be welcome at conhIT from April 24th to 26th, 2012.